Hi, my name is Justine Calderwood. I'm the owner and pelvic floor physical therapist here at the Healing Spot Physical Therapy. I wanted to make this video because I want to share some of my passion on why I started the Healing Spot and what sets us apart here. And I'm going to share several different points. This is really just my perspective based on being in this industry of physical therapy for the last 21 years and the expectation that I had, say, as a therapist working in an in network, insurance based practice that was very busy, and how that prompted me to want to do better for my patients and to offer a different level of care that in my heart I knew my patients deserved, and also a level that I wanted to provide, because at the end of the day, I wanted to feel like I was making a difference and that I was doing the best that I could, instead of just kind of hurting people through the physical therapy line and not really taking pride in my work. So, with that said, I want to share number one is I wanted to be able to practice in a certain way. I wanted my energy, my own personal energy and time valued. What that means is I know for me personally, seeing more than 7 patients a day just was wearing me out. So by the time I got to my afternoon, I was exhausted and I wasn't able to give to my afternoon patients near like I could for my morning patients. And I wanted to do different. I wanted to put a limit on how many patients I was seeing, and how long I was able to see patients. So here at the Healing Spot, I do see patients for a full hour, and I put a little time in between each session for a kind of an overflow. It gives me a chance to run to the bathroom. It gives me a chance to take a drink of water and also to write my clinical note, so I get that information kind of out of my head, and I'm able to then show up fresh for my next patient. It also makes sure that my documentation is more accurate. So when you come in for that next session, I'm going to know what we did the previous session and we can pick up right where we left off, instead of trying to wait until the end of the day and get all this information out of my head about my whole entire day. It's not uncommon for therapists to have to see 10 to 20 patients every single day because they're given 30 minutes for treatment and no time for documentation or even a little bit of a rest break. So it's not uncommon for therapists to get done with one patient, bring them out to the waiting room, and pick up the next one. And there's no gap of time there. I will tell you, it's exhausting as a therapist. And I knew I wasn't showing up in the way that I wanted to for my patients. You deserve to be seen and heard and to be given your undivided attention. I was also expected to document with my patients, so they wanted me to kind of like sit and write. Some therapists have to use a computer or whatnot during their treatment sessions. And my philosophy here at the Healing Spot is I'm going to give you my undivided attention while you're here. I might jot down a little bit of what you told me at the beginning of session, but you will not see me in my computer, trying to take notes while you're doing some exercise. I am fully dedicated while you're here to pay attention to you, okay? And I really feel like that transfers to a higher level and quality of care that, again, you deserve. Number two is I'm really dedicated to that continuity of care, meaning if you start here at the Healing Spot and we have a spot open for you to begin your care with an evaluation, my team, and we are going to do our best to make sure that you're going to be seen the next week or possibly the week after at the latest. So it's not like you're going to start care here and then you have to wait 4 to 6 weeks for your second visit. I want to make sure that, again, we can take care of you and get you in. So it's not uncommon for me. Maybe sometimes at my own health is I'll make room. I will stay later or come in sometimes on my day where I don't normally see patients, if that's what's warranted, in order to not have a lapse in care, because it's really important to me that you get the results that you're looking for. And that comes with keeping regular sessions. I'm going to reiterate the number 3 is just those hour-long sessions. I think that's really important. It's been a trend recently in physical therapy to go to 30-minute sessions or maybe 45-minute sessions. It's really common to do those 30-minute sessions. And me personally, it just doesn't work. When people come in and I'm getting a little bit of information of, okay, how are you this week versus last week? And I'm able to do a little bit of an assessment to see that. I mean, that's cutting into your care. And so we're left with what, maybe 20, 25 minutes to actually do treatment. It's just really fast. And I personally don't operate well in that environment. So offering hour sessions, a full hour, really makes a difference. You're going to get your results and get to your goal quicker if we're able to see you for a longer period of time for each session. And typically I see my patients once a week. I know there's therapists that may see their patients 2 or 3 times a week, but when we give quality care in that hour session, and I'm really dedicated to giving you information and tips and things to do kind of as homework in between sessions, so you're not 100% reliant on what I know and what I can do for you only. You're going to have tools to help yourself. And again, that's going to help you reach your goal quicker. And you're not going to need as many sessions. Number 4, you're going to see the same therapist for every single session. It is extremely important to me that you feel seen and heard. That happens from the very moment that you call us. Even before you get into my treatment room to meet me, my staff is trained to listen, okay? Listen to your story. And you may not know this, but when they're on the phone with you, they are taking notes. They are typing, they are taking notes. Why did they do that? We don't want you to have to repeat your story over and over. I want that information that you just told my front desk person before you come in. I want to have an idea in your own words what you said, because it already helps me to know you as a patient, and I know I'm going to help you better if I have that information. You're going to get frustrated if you have to repeat your story time and again. We've all been there at the doctor where you go in and the medical assistant or the nurse comes in and they say, "Why are you here today?" And they're sitting there taking notes, barely making eye contact with you, and they're clearly taking notes. They leave the room. A few minutes later, the doctor comes in and asks you the exact same question: "Why are you here today?" Why didn't you, one, if you took the note, why didn't you read it, right? 2, why am I having to repeat that? I just told the nurse that. It's very frustrating. That happens to me in the healthcare system, and I don't like it. So I don't want that to happen to you. Before you come in for your session, I'm reading your notes. So it's not uncommon for a new patient to come in for either a consultation at one of our discovery sessions or an evaluation, and I do a summary. Hey, this is what I know. You already talked to so-and-so at the front desk. This is what I know about you. I read your paperwork that you filled out prior to coming in. Please fill in the blanks. And what that does is it really values you as a person. And I think you will see and feel the difference here at the Healing Spot because of that. Number 5, I am dedicated to being the best therapist that I can be. I take pride in that. It's very important to me to have up-to-date skills and knowledge. It's not uncommon for me to read physical therapy books on my time off. Gotten better about not taking that stuff on vacation anymore, but it's not uncommon for me to be on my way to work, listen to a podcast, so I can better understand the world of pelvic floor physical therapy, because I want to do good by you. Okay, I'm not here to just take your money or to waste your time and your energy. I am here to serve you and to help you get better. And the only way I can do that is to stay up to date on my skills and to keep learning. That's super important to me. I've been out in this profession for 21 years and I'm still learning every single day. So with that said, I want to just highlight, I am a certified birth healing practitioner through the Institute for Birth Healing. That's extra training. It's very important to me. I've even repeated classes with Lynn Schulte, to be honest, because I want to make sure that I'm getting the information and I'm doing it well. I'm also a level 3 low pressure fitness trainer, and I'm getting ready to sit for my certification exam. And that's just a very specialized way to help with through exercise with things like prolapse and diastasis and incontinence. Three of the very most popular, I'd say, diagnoses that I see here at the Healing Spot. I'm also currently doing a certification to be a pregnant and postpartum athleticism coach. It's also a specialized training that is very important to me to help, say, women that want to be active, that you may not consider yourself an athlete, but if you're going to the gym, if you want to hike and you want to be active with in your life, I'm here for that. And I want to be the best that I can to guide you along the way. Number 6, I see my patients as whole people. I will never look at you as just your pelvic floor, okay? You are more than that. You are also your head and your neck and how you hold yourself and the trauma that you've had in your life and the beliefs that you have and the mindset that you have. So I really am going to look at you as a whole person. And I think that often surprises people when they come in and we start diving into some of the things that may be impacting their physical body, that they're kind of surprised. Why am I asking you about, what was your upbringing like? Have you had trauma in your life? How was your childhood? Because I know that impacts your pelvic floor and it impacts you as a person. I work really well networking with other providers, mental health providers, doulas, midwives. It's important to me to collaborate with other professionals that have a similar interest in women's health. So I have those networks and I can give resources and recommendations. If you're looking for extra help beyond my scope of practice, it's important to me that you are seen and treated as a whole person. And number 7, last but not least, I am a mom myself. I have 2 beautiful teenage daughters. I was a stay-at-home mom for quite a while and worked very little in physical therapy when they were little. So I understand not only from a personal standpoint, what it's like to be pregnant and postpartum and navigate all the challenges that comes with. I blend that with my professional knowledge, and I really feel like that helps me to show up in a different way that other therapists might not be. It's very important to me to connect with my patients that are moms in that way. Clearly, I'm also a woman, so you don't have to be a mom to work with me. You don't have to be pregnant or postpartum, but I do bring my personal experiences into the treatment room to help. So, all right, thank you for listening to this very long video. If you made it to the end, congratulations. Here's a sticker. Okay, no, but I just wanted to share some of that passion. Hopefully, that came through this video on why I started the Healing Spot, why I show up dedicated day in and day out. And I would be honored to be the guide, to be the therapist, to lead you in whatever is concerning you right now.